Hey guys, it's Leah B from Prestige Veteran Medical Consulting. I am a U.S. Army veteran, physician assistant, and former compensation and pension examiner. So today I want to come on and do a video about what to expect in a compensation and pension exam for breast disorders, right? So there's a variety of breast disorders that veterans can get service connected for, and it's not just women. I know there are a lot of men out there that have service-connected conditions related to breast disorders. Obviously probably not as many as women, but men can develop breast cancer, gynecomastia, lumps in their breast area as well, just like women can, right? So the top 10, kind of conditions that I like to think of when I'm talking about breast disorders is breast cancer is going to be usually the big one, right? A lot of veterans are service connected for breast cancer. Fibrocystic breast changes is another one. Just fibroadenomas, which are usually benign breast lumps. Mastitis is an inflammation or infection of the breast tissue. Breast abscess, nipple discharge, gynecomastia, which is an enlargement of breast tissue in men, often caused by hormonal imbalances, medications, or underlying health conditions. Saw a lot of guys on active duty that were suffering from that and were treated for it while on active duty. Paget's disease of the breast, which is a rare form of cancer that affects the nipple and areola, and just breast pain, lipomas, which are fatty tumors that can be in the breast area. So there are several conditions that can be related to your service, either on a primary or secondary basis. So how do veterans get service connected for these? So we always talk about that primary basis, meaning the veteran was either diagnosed with this while on active duty or active duty status, or it developed because of some type of exposure that they had while on active duty, but then there's a direct relationship to their service. On a secondary basis, people can be diagnosed with breast cancer as a secondary to other service-connected disabilities if a current disability has caused or worsened your breast cancer. And there's just a variety of ways, right? So let's go ahead and start talking about what happens in that compensation and pension exam. So you should get a packet in the mail, and you should get a call scheduling the appointment, and you should get a packet in the mail that tells you where the appointment's going to be, who it's going to be with, what the specialty of that provider is, whether it's a physician, a PA, a nurse practitioner, if it's a physician, what their specialty is, whether it's a gynecologist, family practice doctor or whatever, it should be within the scope of that type of a provider to examine you, okay? So I know veterans often get bent around the axles because they're like, well, why is this specialty seeing me for this? Like, why would an orthopedic surgeon see me for my breast cancer disability? Well, it really is within the scope of any medical doctor or DO to evaluate a general medical condition. They may not be specialties in that field, but they're not performing a mastectomy or some other type of really specific breast procedure. They're just filling out a form about things that are pretty typical that they should know about, right? So I hope that makes some sense to you guys. So you're going to show up to the appointment that day, and they're going to go over what's called a disability benefit questionnaire with you. And I'm going to pull that up. You guys can get these off of va.gov. You can, VA does a great job of providing those publicly for you to review. You can also ask your treating provider to fill one out, although that doesn't necessarily mean you're going to skip a CMP exam. It may, in some cases, you may be able to, if VA feels that you've submitted enough evidence for them to rate the condition. But that's not always, right? So let me pull up that breast condition DBQ, and we're going to take a look at it together. All right, here we go. Okay, let me make it a little bit larger. Okay, let's go up here to the top. Okay, here we go. Here, let's go up here to the top. So, breast condition and disorder DBQ, you can see that they're going to have the your demographic information, like your name, the date of the exam, who's filling this out. Are you a VA healthcare provider? Yes or no? This is not stuff they're going to ask you about. They're just going to fill this out, right? The doctor. Evidence review. What did they review? Did they review your service treatment records? Did they review your oncology records, your VA medical records? Date ranges of those records that they reviewed. What is the condition that you have? What is the diagnosis? Do you or does the veteran now or have they ever had a disorder of the breast? Yes or no? The conditions, breast cancer, mastitis, whatever it is. If there's additional conditions, list them here. These ICD codes, those are codes that this is not a rating code. This is the actual medical code. It's not super important for you, but the doctor will fill that out. Your date of diagnosis, medical history. When did it start? When did the breast condition? What was the onset of it? Including the course of it. Did you have breast cancer? Is it in remission? That kind of, they can put those kind of details in here. Does the veteran have a history of neoplasm of the breast? Yes or no? Was it a malignant neoplasm of the breast? If yes, which breast, right, left, or both? Is it an active cancer? Or if yes, is or was there a benign neoplasm? So was it benign, non-cancerous, yes or no, right, left, or both? Treatments and surgeries, they want to know if you've had any treatments or if you're currently undergoing any treatment for a malignant neoplasm or metastasis, yes or no. You're in watchful waiting. If you have, was it, treatment is completed and now that it's in watchful waiting now after you've had treatment? Are you undergoing surgical, X-ray, antiseptic chemo? Did you have a surgery? Have you had radiation, anti-neoplastic chemotherapy, or other procedures? Have you undergone breast surgery? Yes or no? And then they want to know specifically, because this is going to go into some of those ratings, like how much alteration of the form and size of the breast there was. They want to know which side. They want to know, was there a wide local excision or a simple or total mastectomy, or was it a radical mastectomy? And they want to know, the alterations in the size of the form of the breast. Okay. Did they have to take lymph nodes, biopsies, etc.? Are there any residual conditions caused by the benign or malignant neoplasm, like arm swelling, nerve damage? If you lost a significant amount of sensory distribution in that area because they disrupted a lot of the nerve endings, they want to know that. Did the surgery or radiation treatment result in 25% or more tissue from a single breast or both breasts in combination? Yes or no? Again, this is going to probably help them factor in those ratings. Other pertinent physical findings. This is kind of a catch-all for them to discuss any other pertinent physical findings. Does the veteran have any scars? Because if you have scars, they're going to have them complete scar DBQ also, so that they can rate you for that if it's related to service. Diagnostic testing. Have you had any imaging and or diagnostic testing? If so, what were the results? Like, they want to know about your mammograms, your MRIs, all those kind of things. Functional impact. Does the veteran's breast condition impact your ability to work? If yes, describe, providing examples. And then there's a block for remarks for them to just write whatever if there's additional information. And then they need to certify this document, sign it, put their credentials. So if you're having your treating provider fill this out, make sure they fill this out accurately so VA can connect with them if they need to ask them any questions. So let me stop this screen share. So I hope this was helpful, you guys. I know there's a lot of veterans out there that have experienced breast cancer and are in recovery or other breast related disorders. So if it's related to your service, I hope that you pursue this so that you can get the compensation that you deserve. Thank you for watching as always, and please like and subscribe, and I'm always happy to answer any questions. I try to answer every day. I answer them myself on here. So drop some comments, and I hope you guys have a great day. Thanks.